we are doing our alternative nutrition therapy presentation on cinnamon. Now, cinnamon has been said to be a miracle spice, and so our presentation is to determine if that is true or not. But first, we must understand what alternative therapy is. It is the use of unconventional therapeutic systems used by clients in place of or parallel to conventional biomedicine. Its nutrition therapy talks about selecting and consuming specific foods to obtain vitamins and minerals and other substances necessary for optimal health. And it talks about the linkages between food and health, which relies on scientific background on how nutrients are absorbed and used in the body. So as far as history goes, cinnamon is derived from the bark of a tropical evergreen tree, and it dates all the way back to BCE when the Greeks and Romans offered it to their gods. It is also mentioned in the Hebrew Bible when God commands Moses to use it as in the sacred anointing oil. In India, they use it for respiratory pain and upset stomach and muscle spasms. And in China, they use it for its warming qualities, respiratory problems, muscle aches, and controlling blood sugar. Okay, so its usages in foods is shown all throughout the world. It's added as a sweet and spicy kick to foods. In the United States and Europe, it is used mainly in sweet dishes, so apple pie, muffins, coffee cake, and also as a flavoring for beverages. In Spain, it is added to chocolate, and in the Middle East, it is used for stewing meats, as well as toothpaste and tobacco. It can also be used in treatment, so it's used as a prevention or treatment of certain diseases, such as diabetes. It balances blood sugar, protects the heart, lowers the risk for prediabetes, and prevents spikes in blood glucose levels after meals. It is also thought to help fight cancer and help the brain after liver damage and with wound healing. So Lauren's going to talk a little bit about some scientific research.
Okay. So one of the most popular studies about cinnamon links the spice to type 2 diabetes. There have been 8 meta-analysis clinical studies to understand the effects cinnamon has on fasting blood glucose levels. In all the trials, there was a control group who did not consume any amount of cinnamon, and another group that consumed either cinnamon or a cinnamon extract, depending on the trial. And the results were that cinnamon intake, either as a whole or as cinnamon extract, results in statistically significant lowering in fasting blood glucose levels. So this was then determined that cinnamon helps improves patients with type 2 diabetes and also pre-diabetics' blood glucose levels. And then there's another clinical study to determine the effects cinnamon has on glycemic control in patients with type 1 diabetes. In this study, they took 72 adolescent type 1 diabetics and gave half of the group a placebo and the other half 1 gram of cinnamon for 90 days. And during the 90 days, they reviewed the patient's A1C, total daily insulin intake, and adverse events were recorded and compared between the groups. The results of the study showed that cinnamon had no effect on improving glycemic control in type 1 diabetics. So now that there's been a correlation between cinnamon and type 2 diabetes, another study was done to determine the effects of water-soluble cinnamon extract on antioxidant status of people with impaired fasting glucose that are overweight or obese. So the trial took 22 subjects with impaired fasting blood glucose and a BMI ranging from 25 to 45. The subjects were then either given a placebo or 250 milligrams of aqueous extract of cinnamon. This was done 2 times a day for 12 weeks. And during the trial, they then tested the patient's plasma antioxidant properties and activity was measured. The study showed that the use of water-soluble cinnamon in the diet reduced the risk factors associated with diabetes and cardiovascular disease, but more evidence is needed to have a better conclusion. And then another study was done to determine if cinnamon had an effect on systolic blood pressure and various glucose and insulin-related parameters in hypertensive rats. They used 3 trials where the hypertensive rats would eat sucrose and then non-sucrose diets. They were also then given various amounts of cinnamon. And then various parameters such as body weight, systolic blood pressure, hematology, and blood chemistries were followed for 3 to 4 weeks. The results determined that cinnamon may have roles in glucose metabolism and blood pressure regulation. More research is needed to determine a more accurate conclusion. And then the last study was conducted to see if not only diabetes was affected by cinnamon, but other insulin-related diseases. So in this study, they took 15 women with polycystic ovary syndrome, which is a syndrome where women make too much insulin. The women were randomized, and half were given a placebo, and the other half were given cinnamon supplements for 8 weeks. The results showed that significant reduction in insulin resistant with the group taking the cinnamon and no change in the placebo group. This was just a pilot study, so they need a larger population to determine if cinnamon does have an effect on menstrual cycles. So from all the studies, it is known that cinnamon does come with some extra health benefits. So cinnamon has a direct effect on lowering fasting blood glucose levels in type 2 diabetics, but not in type 1. And then cinnamon may also help decrease the risk of diabetes and cardiovascular disease. And it also may have an effect on blood pressure and other insulin-related diseases, but more research is needed.
Okay, so as far as dosages go, there are no limitations to the amount of cinnamon used in food, but supplements do depend on age, weight, and health. In clinical trials used with humans, cinnamon dosages range from 250 to 1,000 milligrams a day. There is not enough evidence to prove any sort of side effects, but it is believed to be unsafe if used in large quantities. For example, cinnamon helps to lower blood glucose levels, so if it's used at the same time in large dosages and for a long time with anti-diabetic medicines, then it can result in too low of blood sugar, which is not something we want. It also may interact with hepatotoxic drugs, which can cinnamon may contain coumarin, and the reaction can cause worsened liver damage. So, of course, if you want to supplement it, we advise speaking with the doctor. And then just as final thoughts, we believe that cinnamon is an ingredient that can really help one's health. It's very beneficial. And so there is continuous research needed to understand how it works and other effects it has with other diseases. But by understanding the history, the usage, the research, the dosages, and the side effects, we can see why it is portrayed as a miracle spice. And these are our references.
So any questions?
Yeah. Did you guys mention how much volume you need to get cinnamon per day to reap the benefits? You said 500 milligrams. Like how much?
It didn't actually say, because in all the studies that we did, it just had it was a really broad range. So, but we didn't find anything about like how much you eat in food if you get the same benefits. There hasn't been any research like that.
Yeah, just talked about, again, there's like no limitations when you're consuming it in like food products or in beverages, but if you're taking it with other drugs, it's definitely advised to see a doctor and not take too much of it.
So you said 250 to 1,000 milligrams. So, yeah, one gram. You know, it's not very much. But we don't cook with that much cinnamon, whereas in Indian food, it's used like, you know, fivefold. You know, much more in terms of the spices. So I think just adding a little bit to your apple pie is not going to do it. But maybe, you know,
I've seen studies before that talked about like 2 teaspoons a day, which in the American diet would be a lot.
Yes, no, that would be a lot.
Have that many places to put it, and
Right.
you've got to be creative.
And it's a little bit is sweet. A lot has you can taste, you can feel the texture of it. It's like kind of dirt. It's like sandy.
It is sandy.
So.
How did they get the low blood pressure banned on the little rats?
I don't know. We should YouTube it. I don't know.
Great. Okay. Thank you very much.